Senator Sanders.
Thank you. Dr. Schwartz, thank you very much for your service over the years. According to the American Medical Association, which represents over 270,000 doctors, quote, an abundance of evidence from decades of scientific studies shows no link between vaccines and autism, end quote. In fact, there have been more than 40 scientific studies in 7 countries involving over 5 million people, finding that there is no link between vaccines and autism. And yet, today, the CDC has published false information on its website suggesting that childhood vaccines cause autism. Dr. Schwartz, do you agree the existing scientific evidence shows vaccines do not cause autism? If confirmed, will you commit to removing information on the CDC website suggesting a link between vaccines and autism?
Senator, we do not know what causes autism. 1 in 33 children have a diagnosis of autism spectrum disorder, and we owe it to the American people to figure out why. The president has asked Secretary Kennedy to find out what is causing
I don't have a lot of time, and we all want to find the cause of autism. The evidence is overwhelming that vaccines do not cause autism. Do you accept that evidence?
I do accept that evidence, Senator.
If confirmed, will you commit to removing information on the CDC website suggesting a link between vaccines and autism?
If confirmed, Senator, you have my commitment that I will look at that exact website. I have not seen that. I will speak with the Secretary to understand why that
But the Secretary has put that stuff up there. What I'm asking you is, will you remove information which suggests a link between vaccines and autism?
Senator, I have been in many situations where I have had to go to my superiors in the military to have conversations, very difficult conversations, about things that may not have been that may have been concerning to the troops or to the military personnel. And I will do the same with the Secretary. I will go to the Secretary.
Sorry to interrupt you. I just have a brief amount of time. In August of last year, Secretary Kennedy's chief of staff sent an email to the previous CDC director demanding that, quote, CDC political leadership all have eyes on the decisions for approval changes before they go into effect, make America great, end quote. Within days, the CDC director was fired for failing to approve Secretary Kennedy's anti-vaccine agenda. Dr. Schwartz, if confirmed, will you commit that you will report to Congress if you receive directives from Secretary Kennedy or any other individual in the Trump administration to implement policies that are unscientific and could harm the health and well-being of the American people?
Senator, I do not believe that the president or the secretary would ever do what you just mentioned.
Really? Do you think that is the record? He would not do that? Is that what you're saying?
Senator, that I do not think that the secretary or the president would ask me to do something like that.
Okay, thank you. Mr. Kaufman, in 2022, you said that, quote, you would rather perish, end quote, than have any of your 3 children, quote, receive an injection of the COVID vaccine where the risks soundly outweigh the benefits gained, end quote. Is that a true statement?
Yes, it is, Senator.
And yet in 2021, President Trump called the COVID vaccine, quote, one of the greatest achievements of mankind, end quote. I don't usually agree with President Trump, but it certainly was a great achievement. So who's right? Were you right, or was President Trump right?
Senator, I think we are both right. If I may explain that, because I think there have been several things, and Chairman Cassidy alluded to it earlier, that have been mischaracterized. My children, thank God, are young and healthy. And right before that post, I had taken them to a Kroger, looked at antibodies, and they were all antibody positive for COVID-19. And the risk-benefit equation for my children didn't exist. However, and this is very important, and I want to mention Trish Lawrence. Trish Lawrence is my wife's mom, who recently passed away from PLS. She had a condition, a very serious condition during COVID. And I recommended not only for Trish Lawrence, but her husband, Frank Lawrence, to get the COVID-19 vaccine because it was very appropriate in that circumstance. I believe 100% that vaccines are safe and effective and that we should have conversations with our physicians to make a determination on which and what is the best risk-benefit equation for that patient.
Senator Bernie Sanders did not pull a single punch in this Senate confirmation hearing. He laid out the hard facts immediately. Over 40 scientific studies across 7 countries involving more than 5 million people have conclusively proven there is no link between vaccines and autism. Yet, the CDC's official website has published unscientific claims suggesting otherwise. When Sanders pressed CDC nominee Dr. Schwartz with a simple question, "Will you commit to removing false information if confirmed?" the nominee completely dodged. Instead of standing up for medical consensus, Dr. Schwartz claimed he had to speak with the secretary, referring to RFK Jr. It got even more tense when Sanders raised evidence that the previous CDC director was fired for refusing to go along with RFK Jr.'s anti-vaccine agenda. When asked if he would report unscientific directives to Congress, Schwartz insisted the administration would never ask him to do such a thing, choosing political deflection over accountability. Finally, Sanders confronted Mr. Kaufman, who previously said he'd rather perish than vaccinate his kids, forcing him to reconcile that stance with Donald Trump's own quote, calling the COVID vaccine one of mankind's greatest achievements. This hearing exposed a glaring question. Will public health decisions be guided by sound science or political pressure?